Bones are going to be really rare. The mechanism of injury is going to be a heavy-duty impact or severe. Occasionally, like I did have one person who fell backwards and landed on their butt. Didn't seem like a lot, but it was broken too. So anyway, really rare. Don't have to worry about those too much. You do if they come in. Spinal cord, again, I've never seen a spinal. I mean, I have had 2 cases where they did have a cyst that was making, and they just didn't respond to care. So we took an MRI and we're like, there's a cyst right where the injury is. So it was a combination of the two. The cyst had been there a long time. It wasn't malignant, wasn't dangerous, but that was a complicating factor.
And inflammation is catchy, so everything around it's going to get irritated eventually if the inflammation doesn't go away.
Exactly. So, but you don't have to usually worry about spinal cord problems other than the spinal cord is being pinched, either due to the disc or the facets or the trauma around it. The big one, here's the big one. Every person who comes in that has back pain wants to tell me it's a muscle. Okay, so this is the one you really need to learn how to not just differentiate, but explain to patients. And I'll just tell you right off the bat, 99% of the time they're wrong. Muscles rarely are the root cause of low back pain, neck pain, or now in the shoulder, yes, the shoulder is a different joint, but even in the hip or the knee, muscles are almost, or tendons are almost never the problem. It's always disc and ligament, and the disc and ligament kind of go hand in hand. Number one, you're rarely going to have the mechanism of injury, and even if you do, you can't say, nope, it's definitely muscle. Number two, there's symptoms. Muscles hurt, but that doesn't mean there's anything wrong with the muscle. A healthy muscle can hurt a lot if it's guarding a damaged joint, okay? The other thing to remember also, if a muscle is spasming or tight, it's not injured. And this is a key point. If you touch somebody and they have hypertonicity, a damaged muscle, okay, a damaged joint does not want to move. Your body will try and isolate. A damaged muscle will go flaccid. Why? The other thing to remember about muscle, especially when it comes to diagnosis, is muscles are phenomenal healers. They have a huge blood supply. They're designed to be broken down and repaired. They literally break down and repair on a daily basis. That's why weightlifting works so well, is because you go in there and you tear the muscles a little bit, and the body goes in and builds them back even stronger when they were before. So keep this in mind. If someone comes in and has a torn muscle, it will heal. It will heal relatively quickly, and it will heal 100% or close to 100%.
It's got a high blood volume, high energy.
Yeah.
It's gonna,
And if it hurts, so if I tore my bicep, and it's got a lot of nerves in it too. So while it's healing, if you do anything wrong, it will hurt and tell you. So most people are smart enough, as it's healing, it hurts. So when they use it, they guard it, they protect it, they baby it. And so it tells you, okay, I'm healed this point, you can do this much. If you do more than that, I'm gonna hurt, and you're gonna know it, and you're gonna stop. So anybody who comes in now, and I say this because a lot of our patients come in with chronic conditions. Normally the psychology of a patient is when they injure themselves, if it's not severe, they will rest and try and let it heal on its own. And then when it doesn't heal on its own, or if the pain is severe, then they will seek out medical care. So a lot of our patients, when they come into our office, they've had pain for at least weeks, usually weeks, but often months or years or decades. So I have yet to see in my practice someone who's had a muscular problem for decades. It just doesn't happen. Even if they have a muscular problem, if they say I've had this problem for 6 months, unless they're really doing something stupid like ripping it every single day, it's gonna heal. Now, it may still be sore. Remember, the healing process, we'll talk about that later, the healing process is generally a 2-year process. But the pain part of the healing process is usually just the first few weeks. After a few weeks, the pain goes away, and that's because it's the inflammatory response. The first stage of the healing process is the only time you should actually feel pain. So anybody who's got pain after several months, the first thing you gotta understand is that they're doing something to aggravate the condition, to re-injure it. And second, it's rarely gonna be muscular. When a patient comes in here, we want you to, you have a broad scope, and honestly, you were really impressive when we talked to you that you knew a lot of different things, you have a lot of different treatment options, and you enjoy that, the more complex part. We only want you to focus here. And so when a patient does come in and want to talk to you about all these other things, don't get sucked in. Don't follow them down the rabbit hole.
It's a trap.
Yes. And can you do that on your own time and with your own patients? Absolutely. But if they come in and they say, well, what about this, and say, honestly, that's not the scope of, I was asked to consult on PRP. I was asked to consult on this. And that's not related. This is a separate condition. And that's when you would want to come to me and be like, hey, this patient has these other conditions. It's not related to anything we're doing here in the office. And then we'll have the option. We'll either say, okay, set up a separate appointment where you're going to tackle that issue in my clinic, and you'll say, here's what I want to do. I have a high confidence rate. Here, here's how we're going to charge. We'd have to kind of work it on it. Or I might just say, I don't want anything to do with it. If you want to see them in your other clinic or wherever else you're working, do that on your own time.
Yeah, it's all communication and.
We're a niche. People come in for neck pain, back pain, and headaches. Because of what we talked about earlier, because we build trust with our patients, because we focus on their problems, because we're good at what we do, we build trust. And then what we found is all these people with neck pain, remember, this problem is 75% of the public has these problems. So we get a huge numbers, and then 20% of those patients have arthritic knees, arthritic shoulders, arthritic hips. They've been to physical therapy, they're taking medication for them, they don't have a solution to them. And so what we do is, as an office, is we train our staff to ask. And so often a patient will mention, you fixed my neck, can you do anything for shoulders? And I'm like, yes, I can. Let's schedule an appointment, I'll diagnose it, what I think it is, and that's when I go, I think PRP and rehab, because it's such a chronic, severe condition that they've ignored for years. See, the other thing about what you do with stem cells, and if stem cells and PRP are not necessary, if I go out this weekend, and we'll talk about this more in detail about the healing process, and I have a healthy shoulder, never injured it before, nothing wrong with it, and I throw the football too hard and I tear a rotator. If I ice it immediately and then rehab it perfectly for the next 6 months, immediately, within 3 days, I have no need for stem cells or PRP. They will add nothing to the healing process. But if I wait 2 weeks and immobilize it and maybe ice it a little bit, but try and use it 2 or 3 times and re-tear it, I just doubled the healing time and reduced the overall quality of the healing by 40-50%.
So you guys are still using ICE protocols?
Yes, some. That wasn't my point.
Yeah. No, I get your point.
Are you sure you get my point? Because
yeah, I get your point where it's going against the natural healing process to splint it for an overly amount of time, and then you're going to create stiffness, and the healing process, the inflammatory process, is not able to heal the tissues versus giving it care right away.
That's half my point.
Yeah.
My point is that muscles are good healers, skin is a good healer, most of the tissues in the body, bones are phenomenal healers. Ligaments and tendons are crappy healers because of the poor blood supply, because of the high stress tissue. And here's the point, if you do it perfectly, if you have a torn ligament or tendon and it's a simple tear and it's not severe, and you do it perfect, you do everything just right, it will heal to 80% original strength. In a perfect world. Nobody does it perfectly.
Right.
Nobody does it perfectly. They wait too, and it's something as simple as waiting 1 week or re-injuring it once or twice. Dropped it from 80% down to 70% or 60%.
I see where you're going.
See?
Yeah.
So the point is that if you don't do it perfectly and you wait too long, my job, we have to baby these things exactly right just to get a decent outcome. And PRP and stem cells gives a second chance. They restart the healing process and they supercharge the healing process. So unless you want it to heal at 30% strength or 40% strength, which it already has. Now I need the stem cells. Now I need the PRP to get me to 50 or 60 or 70% strength. It's significant. It's just if I got a big cut on my arm, yeah, go to the ER, let them sew it up. If I got a cut on my face, take me to the plastic surgeon. The dude has mad skills. I want the dude with mad skills. I got a cut on my foot. I didn't care who sewed it up.
Right.
But my face, come on. Okay, maybe JC's face, not my face.
Yeah.
Who cares about my face?
His daughter got a big gash right on her lip, and it just scarred really bad. But
She had a big lip,
took her to
so we took
a
her to
lot of
plastic
different
surgeon
doctors.
twice. Because she's worth it. It's her lip, and it wasn't quite perfect, so we fixed it again. She's still beautiful. It wasn't that big a deal. But here's my point, and patients don't understand this, and so we spend a lot of time educating patients. This is really bad pain, So there's a lot to it, but
Yeah.
those are the main points.